Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine a routine shot, something maybe you've already rolled up your sleeve for, potentially offering a surprising side benefit, protection against dementia. With millions of lives touched by this condition globally, the question is, could a common vaccine hold an unexpected key to brain health? Let's dive into that.
Yeah, the idea that our immune system and, conditions like dementia are linked is definitely gaining more and more attention. So the possibility that a vaccine designed for one thing could have this wider protective effect is, well, it's certainly worth exploring in detail.
And it's exactly where we're headed today. We're going to take a close look at some really interesting research. It examines a possible connection between the herpes zoster vaccine, specifically the original live-attenuated version called Zostavax, and a lower chance of developing dementia in older individuals.
Right.
Our deep dive is based on a detailed scientific paper published in Nature and also reporting in The Guardian. Both highlight a very clever natural experiment that happened over in Wales. So our goal here is to understand what the science tells us about this potential link, what it could mean for you or your loved ones, and importantly, what questions researchers are still trying to answer.
Okay, so the core of this research, it really relies on this unique situation that unfolded in Wales. Back in September 2013, they implemented a public health policy for the herpes zoster vaccine.
Okay.
And who was eligible for this vaccine, Zostavax, was determined strictly by their date of birth. Very sharp cutoff.
So if you were born on or after September 2nd, 1933, you could get the vaccine, at least for that first year.
Yeah.
But if your birthday was just one day earlier, September 1st, 1933 or before, you weren't eligible.
Yeah.
And you stayed ineligible.
Exactly. And this very sharp cutoff is what created these two distinct groups that the researchers could study.
And what makes this so powerful, presumably, is the difference in who actually got the vaccine.
Precisely. It's a stark difference. For people just, say, a week too old to qualify, the vaccination rate was practically zero. We're talking like 0.01%.
Wow.
But for those just a week younger who were eligible, the rate jumped dramatically. Over 47% got the shot.
That's a huge divergence. And the thinking is, these two groups, born just days apart, they're unlikely to have many other fundamental differences, right, in health or lifestyle.
That's the key strength of this natural experiment. It allows for a much more direct comparison than if you just looked at people who chose to get vaccinated versus those who didn't, because that introduces all sorts of other potential differences.
Right, selection bias.
Exactly. But here, the strict birth date cutoff created two almost identical groups, except for their access to the vaccine, makes it much easier to try and isolate the vaccine's effect.
Okay, so they have these two groups. How did they compare them?
They used extensive electronic health records from Wales, and they tracked dementia diagnoses in these two groups over a 7-year period following that policy change.
Comparing the rate of new dementia cases.
Yes. Comparing how often new cases of dementia appeared in those who just qualified for the vaccine versus those who just missed out. They used a specific statistical technique called regression discontinuity design.
Okay, can you break that down a bit? Regression discontinuity.
Yeah, think of it like this. Because eligibility was determined so abruptly by that birth date, it creates a discontinuity. The analysis focuses right around that cutoff point. It's almost like a randomized trial created by circumstance, because you have these two very similar groups differing mainly in vaccine access right at that threshold. It helps strengthen the argument for causality.
Okay, that makes sense. And what did they find? What was the headline result?
The key finding was that receiving the herpes zoster vaccine, Zostavax, was associated with a 3.5 percentage point decrease in new dementia diagnoses over those 7 years.
A 3.5 percentage point reduction. How significant is that in relative terms?
Well, that translates to a 20% relative decrease in the risk of being diagnosed with dementia within this specific cohort.
20%, that sounds substantial.
It is. To put it another way, for roughly every 5 people in this age group who might have developed dementia without the vaccine, this suggests the vaccine could potentially prevent one of those cases. That's a potentially huge impact.
Wow, that's a really compelling number. And this wasn't just observed in Wales, was it? Did they try to confirm this elsewhere?
They did. To add more weight to their findings, they also examined data from both England and Wales combined, but using a different data source. death certificates.
Okay.
They looked specifically at deaths where dementia was listed as the primary cause. And again, they found similar protective effects associated with vaccine eligibility. Seeing it confirmed in a larger population using a different type of data really boosts confidence in the initial finding.
So, stepping back, if this link holds up, if it is truly causal,
Yeah.
what are the potential implications for public health?
Oh, they're substantial. If confirmed, think about it. The herpes zoster vaccine, Zostavax, was already a relatively inexpensive and widely available shot. If it also significantly helps prevent or delay dementia, it could become a major tool in our arsenal. Potentially, even more impactful in some ways than some existing pharmaceutical approaches to dementia, given its accessibility.
The study also mentioned something about a difference between men and women.
That's right. The data indicated that the protective effect against dementia seemed to be more pronounced in women compared to men.
Interesting. Any idea why?
Well, the study doesn't definitively say why, but it hints at possible biological differences. Maybe differences in immune response between the sexes could influence how the vaccine interacts with dementia risk. It's definitely something flagged for future research.
Okay. Now, important to be balanced. What were the limitations here? What caveats did the researchers themselves point out?
Yes, several important ones. First, and this is crucial, this study specifically looked at the live-attenuated Zostavax vaccine.
The older one.
The older one, yes. It's important because this specific version is now less commonly used, certainly in the UK. It was replaced by a newer vaccine called Shingles after the study's follow-up period ended.
So we can't automatically assume Shingrix would have the same effect.
Exactly. Shingles works differently. It's a recombinant vaccine with an adjuvant. So further investigation is needed specifically on Shingrix and dementia risk, though other research is looking into that too.
Got it. What else?
The age group. The study primarily focused on individuals who were around 79 to 80 years old when the vaccination program started in 2013.
Right, because of that birth date cutoff.
Precisely. So these findings might not directly apply to people in different age groups, whether younger or significantly older. We need more research to see if the effect holds across the lifespan.
And even with that clever natural experiment design,
Yeah.
it's still not absolute proof of cause and effect, is it?
No, it's not definitive proof. While the regression discontinuity design significantly strengthens the evidence for a causal link compared to simpler observational studies, it can't completely eliminate all possibilities.
Like chance or some other unmeasured factor.
Exactly. There's always a statistical possibility, however small the analysis suggests it is, that the findings could be due to chance or some subtle confounding factor they couldn't account for. That's why replication in other studies, perhaps even randomized trials if feasible, is so important.
Okay. Let's bring in some outside perspectives. How are other experts reacting to this Nature paper?
Generally, quite positively, but with that appropriate scientific caution. Pascal Geldsetzer, who led the study, now at Stanford, emphasized that this study really increases their confidence in a genuine causal link. He stressed the, quote, tremendous importance if it is truly causal.
Strong words.
Anyone else?
Anupam Jena over at Harvard Medical School described the potential implications as profound, echoing what we discussed about the public health impact.
And Julia Dudley from Alzheimer's Research UK noted that this study definitely strengthens the emerging link between shingles vaccination and reduced dementia risk. She highlighted that while previous studies showed associations, this research, because of the design, offers stronger evidence of a direct link, particularly, again, noting the effect in women.
And what about the newer vaccine, Shingrix? Did any experts comment on that specifically in light of this Zostavax study?
Yes, Maxime Tauquet from Oxford weighed in. He's actually done research suggesting Shingrix might also reduce dementia risk, potentially even more so.
Oh, interesting.
He raised a really key point about adjuvants, those ingredients added to some vaccines, like Shingrix, to boost the immune response.
Right.
He speculated that these adjuvants, by creating a stronger or broader immune reaction, might play a role in the protective effect against dementia, which leads to a big question. Is the protection mainly from preventing shingles itself? Or are these wider immunological effects, perhaps boosted by adjuvants, also contributing significantly?
That's a fascinating angle. So, lots of excitement, but also clear directions for more research. Let's just crystallize the main finding one more time in really plain language.
Okay. Basically, older adults in Wales who got the shingles shot, Zostavax, were noticeably less likely to be diagnosed with dementia over the next 7 years compared to almost identical people who didn't get the shot simply because they were born a day or two too early.
And that birth date cutoff was the magic key, allowing that comparison.
It was the key to making the comparison much more reliable than just comparing people who chose to get the vaccine versus those who didn't.
And that translates to about a 20% lower risk in the vaccinated group.
Roughly a 20% relative reduction in dementia diagnoses observed in this specific study population over that 7-year window, a potentially very meaningful reduction.
Okay, so we have this really intriguing link. Let's talk mechanisms. How might a shingles vaccine actually influence dementia risk in the brain? What are the leading theories?
Well, researchers are exploring several possibilities. A prominent one involves inflammation. The thinking is that the varicella zoster virus, that's the virus causing chickenpox and shingles, can reactivate later in life.
Causing shingles.
Right. And this reactivation, or even subclinical reactivation you might not notice, could potentially cause inflammation in the nervous system. We know chronic inflammation isn't good for the brain and is increasingly linked to dementia development.
So the vaccine prevents reactivation, reducing that potential source of inflammation.
That's the hypothesis. By preventing the virus from flaring up, the vaccine might lessen this harmful inflammation in the nervous system, thereby lowering dementia risk.
Okay, that makes sense. What other ideas are out there?
Another possibility is that the vaccine triggers broader changes in the immune system, beyond just targeting varicella zoster. Like it sort of tunes up the immune system in a way that might offer some general protection to the brain.
A kind of nonspecific benefit.
Potentially. And, the finding that the effect was stronger in women might tie into this, as immune responses can differ between sexes. Maybe women's immune systems react in a way that's more neuroprotective in response to this vaccine. It's speculative, but being considered.
Could it be simpler? Like maybe preventing a nasty shingles bout just means fewer doctor visits where dementia might get picked up? Or less stress that could trigger cognitive issues?
That's something researchers call ascertainment bias, or related factors. Could preventing shingles simply reduce healthcare interactions where dementia is diagnosed? Or maybe avoiding the illness prevents changes in care or lifestyle that increase diagnosis risk.
Right.
The study actually looked into this. While it's a plausible contributing factor, they concluded that the number of shingles cases actually prevented by the vaccine was likely too small to fully explain that substantial 20% reduction in dementia diagnoses.
So probably not the whole story.
Probably not. Although, interestingly, their analysis did find some suggestive links between dementia risk and things like having multiple shingles episodes or not getting antiviral treatment for shingles. This kind of hints that the virus itself, its reactivation, might indeed play a role supporting the inflammation theory, perhaps.
Okay, so it seems like reducing nervous system inflammation by preventing viral reactivation is maybe the front-runner theory, but broader immune effects are also possible. We're still figuring out the how.
Exactly. Still early days in understanding the precise biological mechanisms.
So wrapping this up, what's the main message people should take away from this deep dive today?
I think the key takeaway is that this study provides the strongest evidence we've seen so far, suggesting that the older shingles vaccine, Zostavax, may offer a significant benefit in lowering dementia risk for older adults. It's not definitive proof, but it's very compelling evidence from a well-designed study.
What's a practical step for someone listening, maybe someone in that older age group or approaching it?
Given these encouraging findings, if you're in the age range where shingles vaccination is generally recommended, talk to your doctor. Discuss this research. Consider the potential benefits, not just protection against shingles, which is important in itself, but also this possible added bonus regarding dementia risk. Your healthcare provider can give you personalized advice.
And clearly this isn't the end of the story research-wise.
Oh, absolutely not. The researchers themselves are calling for more studies. We need confirmation, ideally through randomized controlled trials if possible, though those are complex for dementia.
And studies on the newer Shingrix vaccine are crucial too.
Yes, understanding if Shingrix offers similar or maybe even better protection is a key next step. And digging deeper into how these vaccines might be working the mechanisms is also vital.
It really is remarkable, though, to think that a routine vaccination could hold these unexpected, powerful benefits for long-term brain health. It definitely makes you wonder, what other connections are out there? Could other seemingly unrelated health interventions, maybe other vaccines or treatments, have surprising cognitive benefits we just haven't uncovered yet?
It's a fascinating question, and this research certainly fuels that line of inquiry. It highlights how interconnected our body systems are and how actions targeting one area might have profound effects elsewhere. Definitely an area to keep watching.
Indeed. Well, thank you for walking us through this really important and hopeful research today.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.